Welcome back. For those of you who just joined us, the topic is minority health in Tennessee, and we're talking to Dr. LPearson, who is a member of the Community Coalition for Minority Health, working out of Meharry Medical College. Dr. Pearson, before we had our break, we were talking about some of the risk factors in terms of cancer and heart disease that have a special impact upon the black community. And I'd like to continue that discussion by having you to first look at heart disease and to give us some of the information relative to the risk factors and some of the problems that we might be, some of the things that we might be able to do to deal with this question.
Okay. Well, we'd like to think about lifestyle. We can't do anything about who our parents were or how old we are or even our race, but there are some things that we can do. The risk factors for heart disease are high blood pressure, and as you know, blacks have more high blood pressure than our white counterparts, and we die more from this disease than others. Black males especially more so than white males, and males more so than females. The other risk factors are for heart disease are obesity, how large we are, how much weight we carry, our diet, especially cholesterol, elevated cholesterol and elevated fats, too much fat in our diet. And then we consider smoking. The Surgeon General talked about that smoking related to heart disease. We know that that's a problem, and we also know that we're smoking too much. We do find that black males smoke a little bit more than white males, and women less than white females. So we're needing to decrease smoking. Stop smoking, if you please, because it increases our risk for hypertension, high blood pressure. But you know, high blood pressure also is a risk for heart disease.
Dr. Pearson, it seems that the same problems that we're dealing with high blood pressure now, we'll deal with when we talk about risk factors involved in cancer. We've been dealing with the same problems over and over for the last 20 years, and it seems that things are getting worse. Now, what seems to be the major problem in terms of getting this information across to people?
Well, first, I think we need to believe that it does happen and that it does affect us, and that we're going to have to do something about it. We have to become responsible for our own health. I think too long have we thought that if I get ill or if I want to be well, that I'll go to the doctor and the doctor makes me well, and I don't have to do anything about what's happening to me. But we have to take charge of our lives and take charge of our health, be responsible for our health. And as I mentioned before, it has to do with our lifestyle. We have to change the way we live.
Well, now, in terms of changing our lifestyles and being careful in reference to our health, we also find that that in some instances that there is a deficit or a decline in the number of persons who can deal with us in reference to this. For example, there are fewer doctors now. There are fewer health care professionals. And so we've got a situation where the diseases are getting worse, it appears, and the number of folks who are there to take care of the diseases seem to be declining.
Well, I don't know if that's true or not, and that's okay. Well, what you're saying is what I just said, that we depend upon the doctors. If we get ill, sure, the doctors are there. They help control whatever it is or help decrease whatever it is. But again, we need to take responsibility for our health. We need to become preventive-minded. And that's what the Community Coalition is all about. We will go in and we implement our program through black churches, by the way. We've worked with 24 churches already, and 24 of those churches have had what we call health fairs, where we screen individuals to test for their risk for heart disease and cancer. And then we intervene. 12 of those churches, we work with giving them educational materials so that they could reduce their risk for heart disease and cancer. So we bring them in, do a health screening, tell them where their risks are, what their risks are, and then intervene. Now, this is where the person comes in. They have to avail themselves for this material. for the health screening.
And so no matter what kind of organization that we're trying to work through, the churches and et cetera, it still boils down to the individual responsibility and his recognition for his own health.
That's correct.
Very good. Now, what about cancer? We've talked about heart attacks and cardiovascular diseases and et cetera, but what about cancer? Now, I understand that cancer is also one of the killers, almost number one, in terms of the minority population and especially the black population.
Cancer is the second leading death in Tennessee for minorities, for blacks. And all of these risk factors that I talked about, with the exception maybe of high blood pressure, are the same risk factors for cancer. Diet, obesity, not cholesterol, even though I think there might be a relationship between cancer and cholesterol, and smoking. These are the same risk factors for cancer as they were for heart disease. And so we still, again, need to be concerned and learn to start changing the way we live. As I mentioned before, blacks smoke more than our white counterparts, black males. And if that's so, then we need to stop smoking.
Well, now, how do you get it across? It seems, and I understand, and I certainly agree with you, that it's information that we ought to try to get across. But it seems to me that in terms of trying to convince people not to smoke, and we look at, in some segments of the black community, especially among the females, that the number of people smoking now is greater than ever, and it seems to be an increase. That, here again, is another problem I think that we're facing. And so I guess what we're looking for is some key to dealing with problems that are, in a real sense, life-threatening.
Okay. They are life-threatening. For by the time we determine that a person has lung cancer and find a spot on the lung, it's too late almost to do anything about it. So we have to stop smoking, change. Now, at our health fairs, we have a test that we do called the breath carbon monoxide test, where we test the amount of carbon monoxide a person has after having smoked cigarettes. And if that's increased, we can tell the person that this is what your carbon monoxide level looks like. Now, you know carbon monoxide is a dangerous substance. Yes. And so you don't need very much before it takes your life. And so if we can show a person this, then they can say, okay, I don't want that carbon monoxide to be elevated. I will reduce it, therefore I'll stop smoking, or at least reduce the number of cigarettes that we smoke. So that's one of the tests that we do. We call it a subjective type test at the health fair. And people can come out and get this done. And it doesn't cost them anything.
Now, where is this health fair?
The health fair is held, we do a pre and post one. And we do it either at the churches that we are working or at the Meharry Medical College or another central location. We bring the people in from the various churches, the members do the screening, which include the diet, the height and weight, the blood pressure, do a cholesterol, find their cholesterol number, and also measure this carbon monoxide that I just talked about. These are, and body fat composition. And these are objective where we use machines and find out what's happening with the person's body.
Now, what if a church wanted to conduct a health fair? Could they simply get in touch with your organization and have you organize everything, or how would that work?
Well, right now we are working with 12 churches, and we have to work with a small group of churches because of our staff. We have a small staff and a small amount of money to work with this group of churches. As I mentioned before, we work with 24 churches already, so we're working now with 12. And then we'll go work with others. But if they would just hold on after we work with these, then we'll be coming to them.
Very good. Let me pause now for another commercial break.
Okay.
But after which we want to talk about homicide, because even though it is not a disease as such, we do know that it has a tremendous impact upon the black population. And we're going to be back with you following this commercial break.